So thank you everybody for joining. I'm going to be pulling up the draft of the white paper here in a second. So I did send that out to everyone. So if you do want to kind of follow along at your pace or, take a closer look at specific areas, please pull it up if you'd like to follow along. I'm going to pull it up here and make it as big as I can for everybody. So this is what we have. This is, as a reminder, everyone, this is the document that we'll be submitting to the CDE steering committee as well as executive committee. So they'll be reviewing all of our recommendations for elements that we think should be created within the NTRR. So everything that came out of our Delphi survey, as well as the subsequent discussions about those results. The idea is we're going to now provide this to them. They can review and ideally approve of it. So that way we can actually start getting into the system and creating these elements in the system. For this white paper, we will have a little bit of introduction, but for this group, I really thought it would really just be helpful to kind of go over the methods that we went through, and then I'll, of course, talk about our results from this group. Please, if you have any questions, feel free to just jump in or raise your hand. So the first kind of process that we went through was a literature review. The very first time that we met, I asked, what are some data sources, repositories, databases that you think will have elements that are appropriate when it comes to the field of epidemiology. So we completed that literature review. We then conducted a frequency analysis of those sources to determine what elements were commonly or very frequently reported to give us at least a starting point of what elements we think might be important. So that was the literature review. Once we were able to identify roughly the 50 most common elements from that review, then we moved into a definition collection. So we identified the elements themselves, and then we identified, are there existing definitions for those elements? And this is the list of the order of precedence that we followed. So when we were completing the Delphi survey, all of those definitions and permissible values came from these sources. We then completed the Delphi survey. That was completed online, 3 rounds. During round 1, the work groups you guys had the opportunity to rate whether an element should be included in the NTRR. You also looked at ranking definitions. So if there's more than one definition that we found, you had the ability to rank them for which one you preferred. You were also able to leave comments for kind of your rationale regarding the selection of a particular element or definition. And then finally, you were able to make recommendations. So if there were elements that weren't in the survey that you thought should be in the survey, you guys had the ability to recommend those, and then those were added in subsequent rounds. Since the Delphi survey was completed, we've met a couple of times to go over things like the comments left by reviewers, data elements that had tied definitions, data elements selected for inclusion by more than one group. So that was kind of last meeting, was we have some elements that our work group selected, but also other work groups selected. So we need to make sure that we're on the same page in terms of which definition and permissible values we're recommending. This group didn't really get too into form structures. Some of the other groups, when it comes to specifically things like labs, the way that the data gets collected is a little bit more complex. So they're looking at some other ways of collecting that data in a standardized way. Here are the overall results as of now. All of the groups are still meeting, so you guys have kind of led the way, so you all will be the first ones to kind of look over what I'm sharing today. And you all will be the first that will kind of have your elements finalized. The other groups are still continuing conversations and having similar conversations to like what we've had. It's just that some of them have a little bit more elements to look through and a little bit more complexity to some of the elements. So this isn't final, but the idea is here in the next month that all of the groups will be where you guys are today. So specifically for epidemiology, this is kind of everything that we've done. So first here is the work group members. I've been your support staff person through this process. Table 1B is what were the sources that were collected and analyzed. So all the sources that you guys recommended that we were able to collect some form of either data dictionary or codebook is listed here. So these are the sources that we used to complete our frequency analysis. Here are the elements that came out of that analysis. So back up here a second so you can see them all. Here are all those elements. Some of these elements were specifically given to a specific work group if we felt that item would be more applicable to that group. Everything on here was reviewed by at least one group. And then the only other thing about this table is, and I need to add this in, is those with an asterisk were part of what we call the core elements. So those are elements that are already have been created within the NTRR. So they showed up in the frequency tables, but we didn't need to worry about putting them in the Delphi survey because they're already created within the system. So we saw for this particular group, if an item showed up at least 4 times in our analysis, then it was pulled and included in the Delphi process. The final results from the Delphi itself. So I have it broken up here kind of by these specific areas. So everything in this table met inclusion either during the Delphi itself or during, discussion afterwards. So I have them broken up into the different groupings that we kind of started with at the very beginning of this project. Once again, everything in this long table reached consensus for inclusion in the NTRR. So starting with patient characteristics, if you all would like to take a look at those. Next, we have injury characteristics. Once again, these categories aren't going to be, labeled in any way in the system. This is just for ease of viewing. And then finally, more facility-based data elements. Now, in a second here, I understand here just the elements themselves. In a second here, I have a table that's going to have the element, the definition that was selected, all the permissible values for them. So we'll have exactly a list of this is how this element is going to be created in the system.
Nick, can I ask a question?
Absolutely.
So there's no gender in the patient characteristics and the race and ethnicity. Is that because it's included already up here?
Yeah. So we have that. Great question. But yes, that was identified as something that we wanted to as a core element. So that gender has already been created in the NTRR system. There's actually 3 different data elements related to gender that have been created within the system because we understand that that's a continuously changing data element and how it can get captured and the permissible values surrounding it. So it has been created in the core, and then we also have a social determinants of health work group that just launched that's also going to be taking another pass at gender to make sure that we're covering it in the way that it should be. Any other questions so far? So the only difference now, I want to kind of explain this before I jump into it, is we have certain elements that have other as a potential permissible value. So something like the patient's occupation, We have a list of permissible values, but the user also has the option to select other. And whenever the user has the option to select other, then we have created another data element that will be able to collect that information. So in a second, I'm gonna jump into the table that's gonna show that example. But here in this table is just the results that came out of the survey. After I go through this, I'm curious if you all think that I should add these other elements into this table. These will be elements that are going to be created in the system, but that weren't on the Delphi because they got created after the fact. And let me kind of jump into it and give you some examples. Um, Finally, we have some elements that we don't think should be included in the NTRR. So the first one was education participation. It actually reached consensus for exclusion. So it reached, everyone thought that it shouldn't be collected. And then we have some elements that just didn't reach that 80% mark, which is what was set for an element getting created. And then we had a few that we talked about and after discussion decided that we didn't want to collect it. So now to all the complex data. Those elements that we met for inclusion that I showed you are listed here on the left-hand side. Then we have what definition was selected from the group, just the variable title for that definition, the actual definition itself, and then permissible values. So just how can that question be answered? So as I said, on the left-hand side, this is just going to be the same elements from that table above.
Wait,
But
when you have free form entry there, it's not really free form entry. Age is going to be an integer, right?
it is going to be an integer. I've put freeform here for the moment in that it's not going to have any permissible values such as options to select from. We understand that the data type that's going to get put in there is different, but I've simply put in a freeform entry for those where there isn't a specific list of permissible values, I mean, I guess that's kind of tying into this one, Dr. Schulman, like what you're saying.
Maybe instead of free form entry for like age, you can put number. For patient's home city, you could put character string. I mean, free form entry sounds like, it's the wild, wild west. Whatever you want to stick in there goes in there.
Sure. Olga, feel free to jump in. I know that there's a kind of distinction between freeform, but you can also put parameters around what data
The forms we're going to be
get put in
using,
there.
or
can I have a word?
Yeah, go for it, Olga.
So in Fitbit, we have a very detailed data element report, and we have rules how we format the data elements. And in this format, if you look into Fitbit, if you ever looked into Fitbit data dictionary, it includes how if the data element is alphanumeric or numeric values, or if it's a file type, and so on. So all this information is available in Fitbit. If it needed, we can include it into this white paper if the group believes it is necessary. Does it make sense as what I said?
Yeah, but maybe use the Fitbit terminology instead of freeform entry. So they've got alphanumeric, you've got, character.
Well, the freeform entry is actually a part of Fitbit terminology. Freeform entry defines that the information could be entered and it is not as a value list.
That's an input restriction, and he's not describing. So maybe the column on the table is misnomer because the data type is a numeric value. And what's the column heading in your table, Nick?
So it's currently listed as permissible values, which is what are the ways that you can answer the question.
And on here, freeform entry is listed as an input restriction. So it
is an input restriction.
Yeah, I don't know. It just seems having freeform entry as a permissible value doesn't really tell the whole story, because the permissible value is going to be numeric, but it's freeform, meaning you're not pulling it from a dropdown.
Correct.
exactly.
It's just the nomenclature. So freeform entry is the, as stated in the FitBER thing, is the input type, sort of. It's not the, I don't know. Just I think there's a better way than saying freeform entry in
Sure.
this column of this table. That's all.
Michelle, do you want to jump in?
Kind of a question and a comment. I see your point, Dr. Schulman. But for some reason, this group wanted to go with the NTDS version, not the FitBER version. And I don't know if maybe that needs to be revisited if what you're saying is, I'm assuming that freeform entry came out of the NTDS. Is that correct, Nick?
Freeform is the terminology that we've been using in the FitBER system. That this is because I have worked a bit with Olga on making sure that when these elements get imported, as you know, Dr. Schulman is saying, that the way that they can be answered, you know, is clear.
I'd be happy if
I've put freeform for the moment as there are no permissible values to select from.
But I'd be happy if you put like numeric freeform entry or alphanumeric freeform entry. I understand what you're saying when you say freeform entry, but I think you need to just be a little bit more prescriptive that we're not allowing anything to go in this. You can't put a bunch of exclamation marks in this field.
Yeah. So I could, for instance, put numeric values freeform entry and just put both of these like
Some will be
points in there.
alphanumeric, some will be numeric, some will be I don't know what they call alpha or character, whatever the usual terminology is for this, but that's all.
Sure.
That's a good point. And also, you know, we might need to think about adding a section about in the cases where a FitBER definition existed, but the committee, the work group preferred the NTDS version. What's the difference? What's the meaningful difference that justifies creating another variable for home state, for example? I guess that would go back to comments on the survey itself and comments during the committee meeting, the work group meetings. What do y'all think about that?
What was that again, Michelle? Say that one more time.
You know, we said our order of precedence was if there was a FitBER definition, we would use it unless there was a good reason not to. And so I'm seeing on these first, you know, 5 that the preferred definition by the work group was not the FitBER version. It was the NTDS version. And do we maybe need to explain, give the rationale for why we
Well, if you
think
go through the rest of this table, is that a minority of them? I mean, did we come out majority FitBER in a few NTDS? This particular page of the table makes it look bad, but if you scroll down further.
Yeah, I'd have to look.
FitBER, NTDS, FitBER. Looks like we're about half and half so far.
And I will say, Michelle, to add some context, some of these elements don't exist in FitBER, and that's why they were selected as NTDS.
Yeah.
But I'd have to go back to the original data that was imported into the Delphi to pull out and distinguish between those that NTDS was the only version and those where, you know, NTDS was just preferred.
Right. I think that would be helpful. And maybe that could be like next steps. Maybe we don't have it in the report. But there are some next steps that we've identified, like we need to get some guidance about PHI, you know, home zip code, dates versus number of days from X to Y, that would come up when you started really getting serious about inputting these common data elements. So maybe one of the next steps needs to be a further discussion about why we're not using FitBER if there is a FitBER element available. Because I think that's what they'll ask us as justification. Don't you think that's reasonable, Olga?
Sorry, I was on mute. Yes, I think it's reasonable. And Melissa provided information regarding PHI and other questions which been asked. So we can discuss it with Nick on our next call.
Michelle, I would like to add, and Nick, we can add this into the white paper as well, the NTDS as a add-on when there was a FitBER definition present was something that did come out of that in-person steering committee. That was an in-person steering committee suggestion that if there was an NTDS that was in a similar alignment, that it was added to the Delphi as a baseline.
Any other comments before we move forward? Here's an example. I'm sorry they're split up onto two different pages, but here's an example of an element that came out of the Delphi that this group would like to collect, that being patient's occupation. So this is an existing element. Here are the permissible values for it. If we look inside the permissible values, we see that there's the option of other specify. So because that is a permissible value that it can be answered in that way, we need to create another element where someone would be able to specify what that other was. So this isn't something that we put into the Delphi. It felt like we would be getting too into the weeds and trying to find all these others. And if we adopt this element the way that it exists, we have to create, you know, the other element. So there's no real need for it to be in the Delphi. But this element here now is not on the above table because it didn't come out of the Delphi. It is now something that has to be created because we have that other. So there's a few other, you know, instances of this happening where it's pretty much going to be a free-form entry where if how you're answering this question does not fall into one of these PVs, then we're giving you the option to free text and write out what, you know, the patient's occupation was in this case. So my question to you all is would you like, because this is now going to be an element that gets created inside of the NTRR, would you like it to be included in this table as well, even though it wasn't in the Delphi, so that we have a complete list of all the elements that are going to be created?
Yes, maybe highlight them in a different color,
Okay,
or put an asterisk next to them and put a little footnote at the table or something.
gotcha.
But yeah, I think
Right.
they should all be on this table where it's all together.
Okay,
Right. There won't be a consensus percentage, so
Right.
that's where you could put some sort of an asterisk or something that and at the bottom that these are related to this, you know, the pre-selected related variable to allow for an other field. And that's where you could say alphanumeric, freeform, or whatever it is.
gotcha.
And I did see a typo on that one, Nick, that you were just showing us about occupation other. It's just from instead of form, but
Okay.
we can clean that up later, but just
Got it. So that's really the only difference in this table versus the table above, is we're going to have some more of those others that get inserted. Other than that, if we want to just kind of look at these are once again just the elements and those definitions that were approved and recommended out of the Delphi.
I don't know, Michelle, maybe just a note for the steering committee to have a small little work group to review all the variables that have others. In some case, you know, you're just being nice when you provide the other field. We may want to just have a checkbox for other, but not specify, because, you know, I'm not sure how helpful it is to have it in there. It didn't fit into one of the known fields. And so, you know, for future purposes of adding a field, when you go back and review these, you can say, oh, well, we clearly forgot this, but at the same time, it allows a cop out. So they don't even look at the list very much and they just put other because they don't see what matches, you know, dentist to healthcare worker or whatever. Just a thought.
mm-hmm. That is a good idea, Nick. If we could put that on the next steps.
Not all the others maybe need to be others.
Right. And the data might not be useful even if people did fill it in.
Yeah, like what other, I'm just going to throw one out there. I see protective device type has an other. Anybody think of another protective device type that's not on that list?
Elon Musk's tank. I don't know.
Yeah, I know. Yeah. All right. Enough said, sorry.
No, we
I
appreciate the
digress.
feedback. I think it's a great point to bring up.
Yeah.
That's just kind of how I believe, the kind of standard is. Well, if we're gonna make
Yeah.
that an option for how you can answer it, and we're asking them
Right.
to specify, then
That's
but
why
we
I'm
can,
saying a separate little work group maybe from the
yeah,
steering. We could look into the ones that have other and decide what really needs to have other and what can just have other as a option, but you don't specify. This way it doesn't need a new variable.
yeah.
You know what might make it easy on the work groups and the others that are going to review this is if rather than just having the normal default where every other line is gray or white, put the ones that are other in a different color so
Okay.
that it accentuates that, because it's the list is a lot shorter if, without the others.
Yeah, I believe we had maybe 8 or so from this group. So we jumped from around 33 elements to around 40 when we add in the others. Something I think we talked about, I may need to pull back my notes from it, but the fact that NTDS reports pre-existing conditions as separate elements, we don't have a predefined, we didn't have a predefined definition for it because that's not how, it's not one question that's asked, but I just need to populate it with our notes from last meeting. We came up with a definition. I don't know it off the top of my head, but I know that we discussed it. So I'll be sure to populate that in here.
That's where they ask yes, no for each condition, right? And we
Exactly. In NTDS, each one of these over here is its own question.
Yeah.
So we're converting that from, we don't want to do that. So we've made it into one element, but that's why, yeah, no standard definition exists for what this element is asking.
And it would be like check all that apply.
Mm-hmm. Exactly. It'd be multi-select, and then I just need to input the definition that we talked about last time. I will say there's a couple elements here related to incident location that pre-hospital is going to be looking at tomorrow as well. So they also were interested in, of course, incident specific information. So this is how it exists currently. Assuming that they agree with what this group has agreed to, then this won't change at all. But that's kind of marked for the moment for review by them. So we'll be discussing that tomorrow. And that is all of the elements. Any other comments, feedback?
Yeah,
I
I was
see.
on. I'm sorry, Nick. Could you scroll up
Yeah.
just a bit to where you had the state
Sure.
incident state? That's a free form entry because we think there's going to be too many territories and provinces. I mean, when we choose a state, it's usually a drop down. If you have people misspelling the states or the provinces or territories, and you got
Sure.
it's a free form entry. We think there's too many other territories or provinces other than states that we would want to include, Canada-wise and things that we couldn't have that as a drop down.
I'm pulling up the NTDS data dictionary right now. My guess is that that's how they report it. So let
I
me
think
pull it
that's
up
what it
and
was.
see.
Yeah, I think that's what it was when we did that one. It was just when we
State.
were looking at it, that was how it was already done, and so we didn't change it.
Correct. We can also do, sorry, let me pull back up our.
So does the NTDS
So
have some sort of.
NTDS does have a note that element values. So they actually use the 2-digit numeric code, FIPS code.
Oh.
So that's a good catch. So we can
So that's not a free form value.
exactly.
Yeah, okay, great.
Thanks, Dr. Schulman.
Yep.
No problem.
So I can add that to that as well.
And again, I'm not as worried about the country, but I don't know if NTDS also does something similar for the country, but maybe not.
Let's see.
There it is, alpha country.
2-digit alpha.
Yeah.
You guys are the first pass at this, so we do really appreciate, all the feedback that, you're giving so that we can make sure that this is structured in a way that's gonna make the most sense and also make it easy for, our other committees to review it. Any other comments? That's all the data, all the work that we've done over the past, 6 months or so, 8 months, however long it's been going.
Nick, for outsiders reviewing this and if you go back to the beginning of the report, do you want to
Yeah.
have a bit of a graphic about the number of
How far?
variables we actually looked into, right? So
Okay.
you got
Here. How many were actually input into the Delphi?
I don't know. I mean, it just screams like a graphic of, number actual considered, number that made it in, number of new. I don't know.
That's kind of this.
That's kind
but,
of that.
But then as you see now, we start adding others that weren't in the Delphi. So
Yeah.
that's another area where I'd love to hear if anyone has any recommendations. What I currently have in here is just what went into the Delphi and what came out of the Delphi.
What about a flow chart? Like we started with 100. I'm just making up numbers. We started with 100 variables. We did our Delphi process. In the Delphi process, 33 were excluded, 8 were added. The final process, we suggested for inclusion these numbers with maybe a couple of notes. I don't know, just something like that.
Okay.
Because otherwise, you're just sort of a lot of data dump in the tables. You're not showing the process as much.
For sure.
Yeah.
Maybe a flow diagram, like
Yes,
like a review.
that's
Gotcha.
exactly what I was thinking.
That's a good idea.
Yes.
Makes sense.
We have those from the NTRR Delphi survey, so Pam can send you a Word version of what we've used. It should work pretty well. It's a great idea.
Perfect.
Is there any reason we should include like a screen grab of the Delphi to show the,
Only if you want to give us PTSD.
It was that bad?
No, but yeah. Is there some obviously this is going to generate a huge report, Michelle. Is there some thinking that there's going to be a manuscript that comes out of this at some point? Because that would be like an appendix to the manuscript, perhaps.
Yes, Dr. Schulman. So what we talked about with the steering committee back in February is that there would actually be four different papers. For the ease of the working groups and the steering committee and the exec committee, we thought we would put all these results in one large PDF that has hyperlinks within it to the different groups, but we're still thinking about 4 standalone papers with the committee members as named authors for each paper.
Okay.
We don't know if we'll get pushed back. We haven't gotten as far as thinking about where we might publish it and whether they might. I don't think they would try to put it all in one paper just because of the word limits and the limits on tables. But that's where we are right now.
Yeah, well, I have thoughts about that. I can where it should go in the future. It may be unpopular, but for something like this that has such broad applicability, and then we talked about harmonizing with other international database, an open access journal might be the best way to go. Like, trauma
do that.
open. That's just my thoughts on that.
Well, we could do that. We would have the funds to do that. The publication fees we could cover.
Yeah,
For 4 different
I would
hubs.
give it the widest
We
distribution.
get it out there much faster.
Yeah.
Usually it does. Yeah. Be great to have comments from the group about journals that you think would be appropriate targets. Ideally, you'll put them all in one, I think, but maybe not. Maybe we target, an epi journal for this paper.
Well, I'm familiar with the trauma JTAC's open, so we could consider that. I'm not sure about what the open access EPI journals are quite.
Are you referring to trauma surgery and acute care open?
Yeah.
Yep. We're very familiar with them too, and I think they'd be receptive.
Yeah. I think they pronounce that JTACs, but
I think it would be interesting to keep them all together because people could find them.
well, absolutely. I think whatever publishing route, they should all go the same route. Yeah.
I'm sorry, Dr. Schulman, you're talking about journal trauma and acute care surgery is
Yep.
not trauma surgery acute care open, right? I'm not sure we're talking about the same journal.
I'm not even sure I'm getting the nomenclature right.
No, you
Elliot's-
guys have them right.
Elliot's-
JTAC,
which one is Elliot?
Elliott's is open. Elliott's is
Yeah.
trauma and acute care surgery open. I call it
That's the one I'm
Tabasco
thinking.
because that's what it looks like. Yeah,
Okay.
Tabasco.
I was using the wrong
Yeah.
acronym for the open journal. I apologize. I was thinking of the one Elliot
But
does.
I
Yeah.
think that the series, I agree that they should be published together, and I think it would be more likely to get picked up in Tabasco, Elliott's journal, because like a series of it, like a little almost chapter with these in there with the different work groups.
We've had success with our conferences where we've negotiated for a special edition.
Yeah.
We get like 5 articles for, I want to say maybe $2,000 total. So that way, I mean, we know that route quite well.
So I guess disclosure that I'm on the editorial board for Trauma Surgery Open. And we are very much interested in things like this, of putting together, publishing collections of articles that are related. And like Elliot would probably go along with publishing these together and having an inviting commentary to go with them, along the lines of this is why it's important.
Molly, I should have disclosed that I'm on the editorial board too,
Yeah.
and I thought that that Elliot
Yeah.
would be interested in that, like as a, with the kind of why behind it, a preamble with the why and the work effort that happened. Because you look at all these work groups, it's a huge amount of work, and I think that it tells a story and comes up with a product, and it's something that is going to improve research in the future. So, yeah,
I think he would be very enthusiastic about this.
And it also should have like in addition to the preamble, it should have a summary paper with it, so that people don't have to go wallowing through all this. They could have access to either on a website or some sort of a link to somewhere where they could when they do their research, they could automatically access something that's usable.
We would definitely include the link to the data dictionary that will be in the repository where all these variables will be. That'd be probably the easiest place for them to go.
And we have a page that will be built out further on the NTRR as a whole on our website. And I like that suggestion, Dr. Ryan, of having connections to the CDE papers.
Any other comments regarding the paper itself, publication, process?
Just thank you for herding the cats and keeping us organized. We started this, I think our first meeting was in January, right?
For CDE, I think was in February. And then I think this group launched in either March or April.
Well, I was kind of close.
Yeah, it's been
it's just a lot of work.
Yeah.
I'm just trying to highlight it's been a lot of work on
Yeah.
and a lot of organization.
for sure.
on your part. So thank you.
Oh, absolutely. And I appreciate everybody's, participation, feedback. If nobody else has any other comments for today, we'll put together some notes from all the great feedback that we got from everyone, start implementing those changes into the white paper. Once we do make those changes, I think we'll circulate it to the team, to the work group. The idea is that, once again, you guys are the first ones, so the other work groups are still about one meeting behind. So this is going to give us kind of a great template for what we can use for the rest moving forward. And then so once I make those changes, I'll recirculate and get any other feedback from you guys. And then we'll be sure to keep everyone in the loop when it comes to us submitting it up the chain of command, as well as what comes back. So if everything looks good from executive committee, then we can delve deeper into the publication process. All right, if nobody has anything else, thank you all for your time. You can have your 16 minutes back and enjoy the rest of your day.
Thanks, Nick.
Thanks.
Everyone.